Hi guys, Micah here, just doing a quick recap on what we covered on the intensive combo course last week. So last week we looked at chapter 6, which is on the endocrine system, and we looked at the key areas within chapter 6 that can be assessed in the upcoming GPHC exam in June. So we looked at areas like thyroid disorder, we looked at hypothyroidism and hyperthyroidism, and we looked at the symptoms of both hypo and hyperthyroidism. We also looked at lab test results for patients with thyroid disorder. We looked at your TRH, we looked at your TSH, we looked at your T4 and T3, which are levothyroxine and liothyronine in synthetic forms. Okay, so we looked at how to manage patients with thyroid disorder. We then moved on to corticosteroids. So we looked at mineralocorticoids and glucocorticoids. The corticosteroids with high mineralocorticoid and the ones with high glucocorticoids effects, as well as their side effects. We moved on to osteoporosis and we focused on bisphosphonates. Very important for you to cover bisphosphonates properly and know the main counseling points when it comes to bisphosphonates, such as taking the tablet whole with a glass of water, remaining standing on a sitting upright position after taking the tablet for at least 30 minutes, as well as other advice that we gave on the combo course. Lastly, we looked at diabetes mellitus, which is the main area within chapter 6 that you'll be assessed in the GPHC exam. We looked at various parts of diabetes, but we focused on the anti-diabetic drugs and insulin. Very important to cover your insulin properly. So I'll just go over some of the quick tips that we looked at for insulin. So the first one, when it comes to insulin prescribing, ensure that insulin is prescribed by brand. It has to be prescribed by brand and it has to be dispensed by brand. Also ensure that the word units is written in full. So we can't accept abbreviations, so no UI or U, it needs to actually say units in full. For the dose, when you receive a prescription for insulin, ensure that you use the 25-50 rule, which is if a dose of rapid acting insulin is more than 25 units, you need to ask questions, you need to double check it. And if a dose of long acting insulin is more than 50 units, you need to ask questions, you need to double check it because it could be unusual. Okay, so I'll say that again, use the 25-50 rule. If the dose of a rapid acting insulin is more than 25 units, that's the dose at one time, more than 25 units, ask questions, double check that it is correct. And do the same thing for long-acting insulin if the dose is more than 50 units. Also double check the strength of insulin that you are going to dispense. Is it solo star or is it double star, for example? When it comes to counseling, advise all patients using insulin to rotate the site of insulin administration. This is to reduce the risk of lipid dystrophy. Also warn patients not to ever use a syringe to withdraw their insulin from their flex pens or their cartridges. This is a definite no-no. Warn all patients on insulin about symptoms of hypoglycemia. They should be able to recognize symptoms of hypoglycemia. So if they're feeling very drowsy, feeling tired, lethargic, lightheaded, those could be potential symptoms of hypoglycemia. Give them advice on how to manage hypoglycemia, and obviously in severe cases we'll be able to administer glucagon. Lastly, cover your sick day rules for diabetic patients. Very important. Cover your sick day rules, and we're going to cover the resources and the SPC links later on the course. Okay, so that's our quick recap for last week. I'll see you next time on the intensive combo course. My name is Micah. I'm the course lead. See you soon.